Welcome back. Our roundtable is very used to tackling the health issues facing Texas. Becca Aronson is from our partner, the Texas Tribune, and Lee Spangler is Vice President of Medical Economics at the Texas Medical Association. Welcome to both of you. Thank you for joining us.
Thank you.
So I understand, Lee, that you've read the entire Affordable Health Care Act.
Yes, I have. Actually, when it first passed, I got a team together and we actually summarized the entire act from front to back as best we could. There are a lot of references that go out to other laws, but we touched every page of the law.
Obviously, this has been a kind of a confusing topic for a lot of Americans, and as the deadline looms, I know that they've reached that 6 million benchmark that they had, but do you feel like there's going to be a big rush in this final couple of days?
There's already been a big rush from what I've read in reports. Basically, people tend to procrastinate like anything else, tax time or I guess open enrollment time. And so there have been a number of delays that some people have experienced in trying to get through the federal website. And so the federal government has actually offered for those persons who try to enroll but for some reason can't finish the process, there's going to be a special enrollment period just after this open enrollment period for those persons.
Why haven't Texans really utilized the act itself? I mean, it seems like even though our Republican leaders don't really want too many people going that direction, Texans still aren't doing it.
Well, a lot of it has to do with education and access to information. The Affordable Care Act is a really complicated law, and signing up is a complicated process. If you've never had insurance before, it might be difficult to choose a plan and know what deductibles are and what your copayment is and how that could factor into your life.
And as far as penalties for the people that don't sign up, what are we going to see with that?
Well, the penalties this year are the greater of $95 or 1% of your income, but that's not necessarily going to be imposed on everyone, although most people have a mandate to purchase health insurance. If the bronze plan is too expensive, meaning that 8% of your income would have to be devoted to purchase a bronze plan, you're not under the mandate. If you've got some other circumstance where you couldn't afford the coverage, or maybe you're part of a religion that doesn't believe in insurance, you're not under the mandate. So not everyone is going to be subject to the penalty, but if you don't fall into one of those small categories, it's going to be $95 or 1% of your income, whichever is greater, and that's going to be taken next year at tax time.
Do you expect that because of that penalty, Texans and Americans that don't sign up might have that incentive for the future?
I think the penalty should be an afterthought. When it comes to purchasing insurance, you should think about planning for your own financial future. An insurance product is a financing tool so that you can finance your health care. I would encourage everyone, if you don't have insurance, to go out, look at your options, whether it's through the exchange or not, whether it's through the healthcare.gov or through a broker. Prepare for your future and plan for those bad events. So I wouldn't think of the penalty that the government might impose as being the worst of it that might face people. I would tell people it's that accident that happens when you're playing basketball and now you've got a knee surgery you have to pay for. That's a much greater penalty than the $95.
Becca, I want to move on to a topic that's very timely this week, the abortion decision that the appeals court says that these rules that the legislature passed in the last, I guess it was it the second special session, the third one? I can't remember.
It was the second.
You know, they can stay in effect. What does this mean? Are we done with this fight just yet?
So we're not done just yet. It probably is maybe near the end of this lawsuit, which challenged two provisions they passed. One is a hospital admitting privileges requirement that doctors who perform abortions in clinics or ambulatory surgical centers have to have admitting privileges within 30 miles of that facility at a hospital. And that's so that they can presumably take care of the patient should something go wrong. And that's what the Fifth Court of Appeals decided, is that they did think that it was a good protection for women. The second thing was an FDA requirement that they follow for medical abortions. The requirements outlined by the FDA and not some commonly used procedures that they've been using that require lower dosages of the medication.
My last question, Wendy Davis, obviously, running for governor was a big face in that fight with the legislature. Greg Abbott's office has been very involved in the court proceedings. Do you feel like that this is going to be one of the main topics based on this decision that we see for the rest of the campaign season?
Well, women voters are going to be one of the main topics for the governor's election, and for some of them this will be a factor. For others, equal pay will be a bigger factor, and so I think, you know, this discussion will go on, but in Texas it might be a little bit different than people outside of Texas see it.
All right, thank you both for being with us. I appreciate it. And a reminder, we have a primary runoff coming up in a few months on May 27th. There are more than 20 races, and we have a complete list online at kxan.com. Thank you for watching State of Texas in Depth. Join us every Sunday morning at 8:30. Meet the Press is coming up in just a few minutes here on KXAN.